Good morning, this is Dr. Fletcher with your Monday Motivation. I'm going to wrap up the month of August with our focus on autoimmune disease to talk a little bit about testing for autoimmune disease. We've really been focusing on autoimmune disease this month because of the massive increase in the incidence of autoimmune disease. We now know that there are over 100 different types of autoimmune diseases, and these are affecting up to 50 million Americans, with stats quoting approximately 1 in 5. That's about a 300% increase in autoimmune disease over the past several decades. So more than ever, a reason to focus on this. So if you're someone who maybe has some non-specific symptoms and you go to your doctor, maybe some joint pain, fatigue, body ache, not really sure what's going on, the first test that you may want to ask for is a test called an anti-nuclear antibody test. This test measures antibodies against non-specific tissues. So if you're thinking about when you're sick and you have an infection, your immune system produces antibodies or proteins to attack to get things back in check. Unfortunately, sometimes there's a misdirect or a misfire, and you start to make antibodies or proteins against your own normal healthy tissue. And this is indirectly what the anti-nuclear antibody is testing. Now, this test is not 100% specific. There's actually a low specificity rate with this test, meaning a number of things can cause it to be positive. There is a false positive rate of about 15%. And those things can be included things such as infections, certain types of medications, maybe cancer. A recent study was looking at the increased incidence of ANA, and what they saw was an alarming rise in adolescents, also in non-Hispanic whites and men and people over the age of 50. So we're seeing this dramatic increase in these tests. And whether you have a true positive test or a test that's maybe a false positive, what you need to consider is this is a warning sign that something is going on in your body that probably shouldn't be happening. And you need to take a deeper look. There are more specific tests aside from an ANA, and a test that we sometimes will use through Cyrex labs. And there are also more specific tests that a rheumatologist could order, or some more specialized providers can order these tests to get more clear answers, maybe if it's lupus or Sjogren's or some of the other ones. But this is where functional medicine comes into play. And we want to go more in depth in looking at root causes, what could be making the ANA positive, and more importantly, how we can empower you to change your diet, your lifestyle, and some of the other facets to get you back to a better place. An ANA can be positive with a warning sign that disease may occur in 3 to 10 years. So the time to take action is now. We've got a podcast that you can download and listen to a little bit about this, as well as a program. So we hope you've learned a little bit, and have a great rest of the week. Thanks.